Hello friends, welcome back to my channel. Today I'm going to discuss about temporomandibular joint. The temporomandibular joint is nothing but TMJ. One on each side of the head is a joint between the temporal bone of the skull above and head of the mandible below is called temporomandibular joint. And articular surface, the upper articular surface is formed by mainly two: articular fossa, articular eminence of the temporal bone. The lower articular surface is formed by head of the mandible. The articular surface are covered by fibrocartilage and not by hyaline cartilage. Hence, TMJ is an atypical joint cavity. The cavity of temporomandibular joint is completely divided into two. They are upper menisco-temporal and lower menisco-mandibular compartment by an intra-articular disc of a fibrocartilage. And coming to articular disc. Articular disc is an oval plate of fibrocartilage, and parts of articular disc are: in sagittal section, the articular disc of temporomandibular joint presents 5 different parts. From before backwards, there are anterior extension, anterior thick band, intermediate zone, and posterior thick band and posterior bilaminar zone. These 5 parts. While coming to ligaments, fibrocapsule, lateral temporomandibular ligament, and spinomandibular ligament, and stylomandibular ligaments. These are the 4 ligaments. And coming to relations, laterally, 1. Skin and fascia, 2. Parotid gland, 3. Temporal branch of facial nerve. And coming to medially, a tympanic plate separating it from the internal carotid artery, and the other is spino-sphenoid. Next is auriculotemporal nerve, and the other one is medial meningeus artery and spinomandibular ligament, and last one is chorda tympani nerve. While coming to anterior or in front, tendon of lateral pterygoid and mesenteric nerve and vessels. While coming to posterior or behind, postglenoid part of parotid gland separating it from external auditory meatus. The other one is superficial temporal vessels and auriculotemporal nerve and external acoustic meatus. Above, floor of middle cranial fossa separated by a thin plate of bone. And while coming to nerve supply, auriculotemporal nerve and mesenteric nerve, these two nerve supplies. And while coming to auriculotemporal nerve, its articular wings enters the joint from its posterior aspect. While coming to mesenteric nerve, from anterior aspect it comes or it supplies. While coming to blood supply, maxillary artery and superficial temporal arteries supplies. And while coming to lymphatic drainage, the lymph from temporomandibular joint is drained into superficial parotid nodes and deep parotid nodes and upper deep cervical nodes. From these 3 nodes, the lymphatic drainage is formed. While coming to movement of mandible, movement occurring at the temporomandibular joint are 5. The 5 are depression, elevation, protraction, retraction, and side to side. Depression, it's nothing but opening the mouth. To that, muscles passing through the movement are lateral pterygoid, digastric, geniohyoid, mylohyoid, and gravity. While coming to next one is elevation, it's nothing but closing the mouth, includes masseter, medial pterygoid, temporalis, and the other one is protraction or protrusion. From it, medial pterygoid and lateral pterygoid, and retraction posterior fibers of temporalis while coming to side, nothing but chewing movement, contains medial and lateral pterygoid of one side contrasting alternative with the of opposite side. And finally, clinical correlation. Palpation of the temporomandibular joint and associated muscles and dislocation of the mandible, and the other one is temporomandibular syndrome. These are the clinical correlations. Thank you for watching my video, and do subscribe my channel, and I'm gonna guide you each and everything in this journey.